I am delighted to be here, and kudos to SafeCare for securing funding to help your members move forward with SCORE. Just a heads up, because of travel costs, and this is an in-person program, I just want to be very clear that the pilot is limited for folks in lower mainland located sites. I mean, we could do it for other folks, but then you're going to have to pay for my travel. So that's the only proviso. All right, so let us begin. If you have ever taken any kind of training with me, you will know that often we begin with a minute to arrive, and especially with Zoom, because you're here in body, but I bet you're not here in mind. So here's a request. If you can please close other tabs, and yes, close your email. I know, but you've already set aside the time, so let us be fully present. So we're just going to do a little activity to have you be more present in mind and body, so they're in the same place at the same time. Super short. Close the tabs, close the window, close the email. Excellent. And now we're going to sit in a posture that has you feel both relaxed and alert. And we're just going to do some specific kind of breathing. It's called a psychological sigh. Super easy. You take 2 short breaths in through your nose. So like this, hold for a moment or 3, and then you do a long exhale through your mouth. So let's do it again. We're going to do it 3 times. Let's do it again. One more time. Bellissimo. Excellent. So hopefully your mind and body are more in the same place at the same time. And that's kind of taking this kind of pause is what SCORE can make possible. So let us begin. This is the roadmap I was thinking for our time together today, tell you a little bit about SCORE. Most importantly, though, I want to know what you want to know about SCORE. So we'll get that out at the front. And then I'll go through, I have a PowerPoint, we can go through that, and I will hopefully be weaving in responses to your questions throughout. And then any other questions we'll answer at the end. So I'll tell you a little bit about the research, how SCORE works, why it works, the cost benefit, and then the application process with SafeCare and the process of moving forward. So that's the plan. Here we go. So let me just tell you a little bit about SCORE before I ask about you. So it is an acronym. It stands for Strengthening a Culture of Respect and Engagement. It is an evidence-based program, so it really does increase work groups' respect. We know that from the research. And it does this because it expands employees' capacity to meet the challenges of working in highly pressured and stressful environments like seniors care. A high-level reason for why the program is effective, like why it actually does what it's supposed to do, is smart people developed it. No, it wasn't me, because I'm not that smart. So they developed it through trial and error. A version of the SCORE program has been around for more than 20 years. It's been done with thousands of work teams in healthcare, some in seniors care, and also in many other sectors. So those smarty pants folks, through the trial and error, they figured out that the work group approach is most effective. So that focusing on a work group's culture is the path to change versus trying to improve specific individuals through education or treatment. So this is all very interesting, and I'll tell you more. And I want to be mindful of your time and ensure that we tell you what you want to know about SCORE. So I know I asked you to close all your tabs, but now I'm going to ask you to open one. So if you can go to menti.com. You can see it there, www.menti.com. And if you can enter in this code 25194292, and the first question will pop up. So why are you curious about SCORE? Like, what challenges are you hoping SCORE will help you with? And so this is a text field. You can put in up to 200 characters.
What was the code, Mary Ellen?
25194292. It's actually on the top of the screen as well.
Oh,
I've also dropped in chat if you'd like to copy and paste.
So what, if you have problems, what challenges are you hoping SCORE will help you with? Or just even why are you curious about it? folks entered in things. Oh, here we go. Curious about the program and the benefits. Okay, good. Well, if you haven't heard about it, you are going to hear about it now. Yes, indeed. So team benefits, passionate about culture, creating workplaces where people want to work, feel valued, cared. We spend more time at work. Yes, it's true. So kind of alignment with so team benefits. And want to work. Yep, people want to work. That's an interesting thing. We'll say that one. Okay, good. Excellent. So I know there's 3 of you. So did you all put it in something? Those who wanted to? Okay. For those, the person who didn't, oh, here we go. Want to improve the culture and know more about the program. Okay, good. So we're talking about culture. We're talking about team benefits, and you want people to want to come to work. Good. Super helpful to know. Next question. I think I already know the answer. So did you learn about SCORE at last week's Conversations with Leaders webinar? The reason I'm asking is because I did this is just a yes or no, because I did a bit of an information thing there. Did any of you attend it? I don't think you did. Okay, good. All right, so that is helpful for me to know because you don't, that's good. And then, so what would be helpful for you to learn today? What specific stuff are you looking for? Again, this is a text field, 200 characters. How the program works. Say more about that. I think you should be able to enter in put in multiple things. So like the logistics of it and like the background, how to implement it and get buy-in. Okay, good. How to get buy-in. That's an interesting one. Okay. And Kajal, other folks haven't popped in yet, no? No, oh, you're on mute. But
Not yet, but I'm keeping an
Yeah.
eye on it.
okay, good, thank you. All right, and how it works and examples of how it's impacted culture where it's been employed. Good, good, we can do that. Good, I think we're on track. Excellent. Thank you for doing that. I appreciate your patience in terms of entering in the text because it'll help it stick in my memory. Plus, then I can look back at it because otherwise I might forget. All right, so this is all good to know. Let me tell you a little bit about SCORE, kind of a little bit about how the program works. I'll tell you a little bit about the evidence behind it. So it's evidence-based, as in many studies prove that SCORE's outcomes include decreasing incivility. So it improves civility. So we've seen this in research on the SCORE predecessor program that's been around for more than 20 years. We've seen it also in many studies, including, I picked out one particular study because it was done in Canadian hospitals. So it's the Canadian healthcare system, and it's relatively recently that the study was done. What they found is that that SCORE not only improved staff-to-staff incivility, it also reduced supervisor incivility. And that's kind of important, specifically important actually for nurses. Not sure if you're aware of the research, you probably are. Supervisor incivility is strongly related to nurses' intention to leave. It's probably that for everybody, but we really know that for nurses because there's been tons of studies on it. So I can attest personally to SCORE reducing incivility incidents at work because of results that we did in a pilot. So SCORE has been done in lots of different places, has not been done in long-term care in BC. We did a pilot, a year-long pilot with a local care home, 2 of their care teams. Part of SCORE is a pre and a post survey so you can actually see the results if there's any change. And this is the results from what the 2 work groups. So we looked at, there's a bunch of graphs. This is one of them on work group civility. Blue is for before. That's how I remember. Blue is before. Green is for after. This is for group 1. This is for group 2. So mostly you can see that it went up. I mean, that's really the point. It went up and it went up dramatically. So how people perceive their supervisors' civility improved, their coworkers, and themselves. And orange is the average, or is kind of the norm mean, because this particular assessment has been done with, it's been done with lots of different work groups. I do not do this assessment. Fancy Pants Professor Leiter does it. He's got all the backstory of why this is all very effective, but these are the results. And I want to be clear. Finnish Homes, because it was Finnish Home, these results are not a fluke. The predecessor program CREW, done with thousands of work groups, found the same thing. That program's been around for 20 years. These are validated results. We've seen many peer-reviewed academic papers that have written about these results. All this shows that SCORE reduces incivility, including when people are stressed. So SCORE expands a team's capacity, so talking about team stuff, to behave in civil and respectful ways with each other, even in the midst of challenges. Because that's when people aren't so great, right? That's what it improves. And it decreases other things too. So we know that it decreases indicators of burnout. This fits with tons of studies that show that fostering civility in the workplace decreases burnout. And here's what happens: less burnout, less incivility, improved well-being of your workers, improved mental well-being and physical well-being. And you can see what else SCORE reduces. Absolutely, absenteeism rate. So in that Canadian study, they found that absenteeism for the intervention group dropped by more than a third compared to the control group, which makes sense, right? Because people want to come to work versus calling in because they don't want to work with, Bobby Sue, because she's really unpleasant to work with. So this is very real. And let me explain this. So SCORE is a group-driven activity. So the work group, not the leaders, decide what they want to get out of SCORE. So they come up with a purpose. They come up with why they want to do this. So we identify this in our first 1 or 2 sessions. So for both groups it finished. So we asked them, so why do you want to do this? Why are you interested in strengthening the Finnish home culture of respect and engagement? So we asked them, and they came up with, here's what both groups said independently. It would make them want to come to work more. It would make their work easier. That's what they said. That's why they wanted to do this. So the connection between civility and absenteeism, the research shows it, and the staff themselves, they know this. So with this stuff decreasing, the research unsurprisingly tells us that SCORE makes more good things happen, like job satisfaction. So in that Canadian hospital study, it improved job satisfaction by 9.21% for the CREW groups versus the control group, it was like less than 1%. So you think, oh, come on, 9.21%, who cares? Well, I can tell you, it increases organizational commitment and it decreases job turnover intentions. That is a big deal. And trust in management improved by 4.42%. Again, you think, yeah, big deal. Well, here's the thing. It makes a big difference. These small changes make a big difference in terms of people's interactions and how committed they are. So this is all lots of research, lots of data, lots of numbers. How does it look in your home? How does it show up in the culture? Like, what difference does it make? So let's see what Mary Podsnick, she's the director of care, and Tanya Rautovic, she's the administrator of Finnish Home, what they have to say. So I'm going to show you a video. It's excerpted from a post-program debrief one-on-one conversation that I had with the two of them. And I refer to the group debrief because in our last group session, we debrief about, what actually changed. All right, let's see if the video works. This is exciting. Let's see.
So are people happier? It sounds like
Can you
there's
hear
more
it?
team stuff. Like, is there
Can you
more
hear it? Okay.
happiness, less stress? That's what people said in the programs, but like in the debriefs and stuff. But I'm just checking.
I think so. I feel like when I walk in, I feel like the atmosphere is light.
Yeah.
There's no feeling like, oh, there's pressure or stress, and people are more readily smiling. And even if they look busy, they don't look busy and stressed. I think there's a difference. I would say it's like the atmosphere is lighter. I don't know if that's the right word too.
Yeah, there's a different environment. You walk in and there's not the tension. But again, I think it's like people are now like, they're saying things about things that bother them rather than like bottling it in and then exploding, but rather saying, hey, like, let's have a chat.
Imagine that. Let's have a chat. People actually doing that. So let's talk about how SCORE does this. So it's all about targeting work group culture. So somebody had mentioned that culture is a thing. Well, that's actually what SCORE is all about versus trying to improve individuals. So it works with a team. We don't do something to a team. The team, the work group are active agents in the process. They drive the goal, which we just talked about, which has them feel accountable for improving their workplace culture. And SCORE supports them taking action, supports them changing their behavior, changing how they interact with each other day to day, including when things aren't so easy. So work group members need to be willing. You need to have some number. So it doesn't need to be a majority of your work group, but let's say a quarter or a third, depending on how big your work group is, that are wanting something to be better and are willing to do stuff. And the leader is a part of the team. They're not responsible for SCORE. This is not a leader-led thing. This is a work group-led thing. So as I said, we have the survey that's done before we begin, right? It's anonymous. Only work group members of that work group, not leaders, complete that survey. So it's validated. We look at civility. We look at social encounter scale. Again, Dr. Leiter is the one that takes care of all that. Here's the thing. Seeing the survey results can be a wake-up call. So that's what happened specifically with the first fit with the group 1. And so I have a theory about why SCORE is so effective, and it's based on theories and research and the data. I think it's super effective because it gives people the time. Just like we had our minute to arrive, they have this time, 50 minutes once a month for like 8 or 9 sessions to slow down. It gives them opportunity to get familiar with each other. And it gives them an opportunity to experience something called elevation, which was when we are uplifted by witnessing others doing kind things. So they get to pause and actually notice that. And it also gives the opportunity kind of for the setup for positive nudges, for people, encouraging each other. And most importantly, the opportunity to see themselves and each other as the mere flawed mortals, human beings that we are. And then they get the guidance. They're trained on how to increase positivity and respect and how to navigate the difficulty that is inevitable because we are all mere flawed, normal human beings. So really, SCORE works because it increases people's emotional intelligence. It increases their self-awareness and it increases their empathy because they get to know each other. It also increases their social intelligence. It increases their impact of the awareness of their impact on others. And it improves their ability to deal with social situations, to work with each other. And it expands their capacity for psychological safety because that's what they experience in these meetings. So some specifics, it's a facilitated process. It's all customized to your organization. Like we do what's needed for your work group. There is like kind of main content that needs to be delivered, but it's just the ideas. We're going to deliver it in whatever way is going to work for your work team. It's a series of 50-minute workshops. There's 8 or 9, depending on how fast your team is really. And a supervisor is involved. Your supervisor, not me, like a supervisor. You need to provide a supervisor who's going to support the work group between sessions, running the 15-minute weekly SCORE huddles. And I, of course, instruct and mentor people on how to run the huddles. So that's why I think it works. So let's look at the research of what will make it more likely that your work groups will actually achieve these benefits. So again, this is from research that was done with CREW, which was the predecessor program. They found that first thing, the facilitator skill, because they had internal facilitators doing it, as in people in the work team. So they found that the skill of the facilitator made a difference on how effective the program is. What a surprise. So here's the thing. I will be the facilitator of the program, and you can count on my expertise. I've been doing stuff for a long time. I have training in emotional intelligence, mindfulness, positive psychology. I'm a certified coach. I know how to build psychological safety. I'm curious. I will be flexible in terms of customizing things to your team. And I'm very good at being a structure of support and accountability for leaders and for teams. And I am a flawed mere mortal. I will make mistakes, and I have made enough mistakes in my life that so I've had enough practice cleaning up my messes so that it's instructional for all. because that's kind of part of the point, is that people kind of clue in on how to navigate that. So facilitator skill is kind of a key thing. Work group participation, so I've touched on this, is best because we have the monthly meetings and the weekly huddles. It's best if you can have consistency of the same people attending the work group, the meetings, and the meetings especially. And we saw some trading out happening at Finish Home, and it was okay. It worked out okay. It's great if you can have the consistency, but you know, there it is. Life happens. Here's the final thing that's going to kind of be a big predictor of how successful it is the perceived engagement of your supervisor in the program over time. It's crucial because it sends a message to staff that this really matters, that that leader cares. And we know that from a ton of research. When people and it's research done specifically in seniors care. If people feel supported by their boss, they are way more engaged. You're going to have less injury. You're going to have lots of good things. So that's really important. And leaders set the tone. So the goal is driven by the work group. The work group is going to be changing their behaviors. SCORE, I provide information, right? We kind of give tools. So we're all planting the seeds, but leaders need to water those seeds. So leaders, the work group leader, they need to be able to foster that deeper connection with the team, to remind people about that elevation thing, right? Like they're witnessing other people doing kind things. They're going to be providing that structure of positive nudges. They're going to be supporting. So that's kind of important. So why would your organization do SCORE? Well, because you have problems. So everybody has them. And if you don't have any problems, then this probably isn't the right program for you. But if you have problems, and if you're thinking of a particular work site or work group that's really not great, maybe where staff don't treat each other so nicely. They may be great with residents and with family members, maybe even with students, but with each other, no, they don't. They take things personally. There's incivility. Leaders feel like they are spending so much time on staff-to-staff issues that staff should be figuring out themselves. So the leader feels like a referee or a negotiator. So that's one example of a problem. And that can often lead to absenteeism. So you have long-term leave, right? Because people, they are off because work isn't such a great place. Or you're frequently needing to find coverage because people are calling in because they don't want to work with Bobby Sue or whoever it is. And what does that do? That impacts your quality of care because you don't have continuity of care. And then what happens as well, you might have problems with employee turnover and recruitment because people are leaving because it's yucky. They don't want to be in that workspace. And finding people who are going to stay, it's not so easy. So if these are some of the problems that are showing up, this is kind of what we see. And this is what we heard in last week's conversations with leaders. Here's the thing. Problematic workplace cultures rarely fix themselves. So you've tried stuff, right? Maybe you've done one-off workshops. Maybe you've sent people on courses. Maybe you've had feedback conversations that escalated to disciplinary conversations. Maybe you've experimented with SafeCare's Civility Matters toolkit. The problem hasn't gone away. Maybe it's even gotten worse. I don't know. So with all of that, you and your team are ready. There is a genuine interest in something changing. It's enough of a problem, enough of a priority that you are willing to invest time and money. So we saw this actually with Finish Home. So the reason that the pilot even happened is because the OH&S committee approached Tanya and they said, we want to have some respectful communication training for staff. Of course, everybody else was the problem. And, I get that. And either way, there was a recognized need for something. And that's important because this is a key point. Participation by staff in the SCORE program is voluntary. So people have to want to be there. So they have to want to attend. And don't worry, it does trickle over to others because new norms are set. I mean, the results from all of the studies kind of show that. So you have all this stuff happening and it costs you, right? There's the soft costs. So we have all these things, right? You have the soft costs, the labor costs. It's going to be affecting the frontline staff because we know from research on incivility that 80% of folks say that they've lost work time worrying about incidents, right? There's going to be time that's sucked up for your work group leader because they get to be the negotiator. There's time it can with if it gets escalated to HR and if it gets escalated to your senior leader. So it takes time. All these things suck up your time. And then there may be hard costs. Maybe there's work safe claims. Maybe there's lawyers that are involved. Maybe it's just about agency staff, like having casuals coming in. So you're, paying for somebody off sick and you're also like that recruiting. You know these things. So when we asked this question in last week's conversations with leaders, how much does it actually cost you? Just a ballpark of time. So what we heard were that, maybe for an issue, and we have a union, we might have 2 or 3 meetings on an issue, and each meeting is an hour. So that's like 3 hours for an issue. I don't know how big the issue is. It was in a poll. Who knows? Other people, it ranged from 3 to 4 hours a week to 1 hour a day on average. So it can take anywhere from 12 to 20 hours a month, or if you're not looking, because seniors care is 24/7, maybe it's 30 hours a month. I don't know. So think for yourself, how much do these problems cost you? So I'll just give you a moment, and thinking about the labor, the number of hours per week, per month, and any hard costs. So I'll give you a little moment to pause. Okay. So how can SCORE help? Well, we know that it's going to decrease this stuff. I don't know how much. I can't guarantee anything. What I can absolutely guarantee is that you are going to have more civility, less incivility. I don't know by how much, but I can guarantee that. Like something's going to change. Like that, I know. I don't know how much, but I can tell you something's going to change. And likely your absenteeism is going to decrease. So I can think of, I didn't ask Finish Home about the statistics on that. What I did hear throughout the program from Tanya and Mari, they would do their monthly schedules. And as we would go through SCORE, they wouldn't have people saying, oh, I don't want to work with her when they did the monthly schedules. Like they had months where they did not have that. And it was remarkable to them because that was unusual. So these things are going to improve. I don't know how much, but I can tell you that they're going to improve. So here's the request to you. Think for yourself, what would be the savings if that time investment or the hard cost investment or your costs, if they declined by 10%, by 25%? I don't know, but just think for yourself, like how much would this actually make a difference for you? So think for that for a moment. Okay. One more piece about the improvement is that improvement goes beyond these quantifiable bits. There's also reputational and well-being benefits of your staff not getting injured at work, of their increased well-being, that we know happens with less incivility and less burnout indicators. There's also the benefits of people wanting, somebody said that, right? You want people to want to come to work, of people wanting to come to work. The environment being lighter, like Tanya and Mari were talking about. And so it was a 45-minute debrief conversation, so there's lots in the video, but I can tell, like they talked about people being happier. And I heard that in the debrief session with the team, like people are laughing and smiling. It was lovely. And the benefits in your staff's life of improving their emotional intelligence and their social intelligence. So you can't quantify that, and it does something like it does. And I want to be clear, SCORE is not magic pixie dust. It does require a commitment. It does require an investment. So here it is. So there is a time commitment. So you need to have your work group members involved, the frontline staff in the identified work group who attend the monthly meetings and the SCORE huddles. And these are the ones that are willing and they want to improve. They don't need to be gung-ho, and they can be quiet folks, but they want something to get better. And maybe it's just them knowing how to deal with cranky pants Annie, like whatever. They just want to have some support. So depending on the size of your work group, you can figure out who that is. But so that'll be 2 hours a month. Just a side note, so that's the 1 hour for the monthly meeting and then the 15-minute per week huddles. people who don't attend the monthly meeting are still welcome to the SCORE huddles, and it can be an interesting and helpful experience for everybody, because that's what happened at SCORE. And it was it's kind of how SCORE kind of seeped in with other folks that were not coming to the monthly workshops. And then you need to have the time commitment of the work group leaders. So they're going to be attending the monthly meeting. They're going to be debriefing the monthly meeting with me because I don't know the work team. So I can say, hey, did you notice how Jane said blah? And the work group leader can say, oh yeah, Jane always says stuff. She doesn't actually follow through. Or it could be, did you see how Jane did that? And the work group leader says, I know, and she never does that. I wouldn't know, right? That's why we have the debrief conversation. And that's also where we figure out what they're going to be doing in the huddles. And then before we have the next monthly meeting, I need to find out what's going on. So that's why they have the 2 to 4 hours a month. And then there's a project sponsor. This is a senior leader in the organization. The more senior, the better, because they're going to be doing the budget approval. They're going to be supporting the work group leader, and they are going to be publicly supporting and acknowledging improvements in the work group. That's part of that positive nudging thing. So there's a time commitment and there's a money commitment. So Safe Care will be providing matching funding for 2 organizations. So the program fee is $20,000, and so then Safe Care will be providing half of that. So just to put that financial investment in context, so a member of Safe Care's TAC committee, they ran the numbers. They said that a $10,000 investment in SCORE is equal to 45 days of sick leave from one frontline staff person. Now, I don't know how much sick time you have. I don't know how big your organization is. And I can't guarantee that you're going to save that in the first year. And I can tell you absolutely that absenteeism will decline. I don't know by how much, but I can tell you that it's absolutely going to decline. So you can decide, is it worth it? Really, is it worth the investment? Is it worth it comparing the cost of what you're doing now to what you're going to gain with lower labor costs, less time sucked up, less energy sucked up, less hard costs, and that not easily quantifiable, but good stuff? Okay. I'm going to go on to the logistics. Is that all right? Okay, good. So the logistics of SCORE, the roadmap, once your organization has been selected. So we have a planning meeting. So the program itself, the monthly meetings are in person, but the planning meeting, it's going to be done by Zoom. So this will be where the senior leader and the work group leaders will be meeting with me and probably Safe Care, Kajal and Jen, where we will identify your work groups, figure out how many people you think will actually be showing up, scheduling things, and also hearing what are the outcomes that you are wanting or hoping for this team. Can't guarantee them, and it's super useful to get context. But we're still not ready to start. The next step after that is getting alignment with your stakeholders. So with your OH&S committee, because this is, right, a work group thing. You want everybody to be thinking it's the greatest thing. You want them to be on board. This isn't about, kind of shooting anybody down. It's all about supporting folks. So you want your OH&S committee on board. So just, again, we can just do a Zoom call with them. You want your union on board. You want them to think that this is a good thing, because it is. And we did not do this in Finish Home. So this is an example of one of those mistakes that we learned from. You want to get your frontline supervisors on board. You want to have a meeting just with them. And so I will, be doing that meeting with them, because otherwise they're going to think, maybe, depending on how civil they are, that they think everybody's out to get them. That's not the point. And they also they're kind of important for supporting folks. So having all of those stakeholders aligned so that they clue into what the intention of the program is, that's super helpful. But we're still not ready to go. The next step is your internal promotion of the program. So this is where you get to shine, because you know what gets people excited. So you can have a letter from your senior leader, you can have posters, you can chat it up, you can have information sessions. You know what works for you, just to get people, so they know what's going on. They have clear expectations, and they don't think that anybody's out to get them, that this is actually a good thing. And people, the meetings are lovely. People are so vulnerable. It's remarkable. It's very sweet. All right. So finally, we've done that. Excellent. Now, the reason you've done that is you want people to complete the survey. It's anonymous, only done by work group staff, the identified work groups, not the leaders. We get the results, and then we start meeting. In the first meeting, we make agreements. We may also talk about the survey results, depending on what happens. In those meetings, they're in person, 50 minutes or 55 minutes. We're going to be working with 2 work groups. We can do that, but 2 at separate times, but we need to meet with them on the same day, hopefully close together in time. In those meetings, I'll need a projector because I have PowerPoint slides, and we need a quiet and confidential space to move around, like where people can move around. So not where residents can walk in, because that's what we've had before. So not that. Leaders, the work group leader, not the project sponsor, the work group leader will be attending as a group member. They don't have any privilege, no privilege. And that's very clear. We might also have safe care reps sitting in, Kajal and Jen, and we'll design that with the work group. So we have that meeting, we have the first session or whatever, we have a session, and then we debrief about it. That's where I talk with the work group leader and I understand what's really going on. We talk about the huddles, then the huddles happen, right? And then we debrief what's going on with the huddles, what's happening, and then we plan for the next session and rinse and repeat. So we do that 8 or 9 times. To the second to last session, then we do a post-program survey so that everybody knows it's going to happen, right? So we do the same survey again so we can see those results. We debrief it in the group meeting so everybody sees it and we can talk about it. And it's intriguing hearing people's comments. And in that last meeting, your work group, figures out what are you going to do to sustain it. So it is not on the supervisor to hold it together. That is not cool. It is a work group driven project, so it cannot be. So you need to have folks internally that are going to step up. And that's what you do in the next steps thing. And the ideas can be quite lovely. And I'm mindful of the time. One quick example. So at Finish Home, they would have monthly meetings with care staff. And that is where Tanya and Mari would tell people what they're going to do. And they wouldn't actually get very far because people would just be resisting the whole time and complaining about stuff. And it was not a pleasant experience for anybody. What staff said in the next steps, without Tanya and Mari saying anything, was, we have those monthly meetings. I think what we should do, and this is what the staff said, we should get together as a little group, like, just a few of us, to decide what we want to talk about. And then we can talk about it beforehand. And we'll come with kind of our list of things that need to be done. Like, I thought Mari was going to fall off her chair, right? Like anyway, so good things can happen. So that's kind of the next steps. I am mindful of the time. So here we go. So if you're keen, if you think that this may be a good thing, it is a good thing. There is an application. It's available online. You will complete it. Please complete it with brevity and conciseness. There is a closing date for applications, Thursday, March 13th. After that, and you'll be sending it in to Jen. And I think, Kajal, you're going to you put the link in the thing for downloading it.
I put the application in the chat.
You're so good. There it is. All right. So you complete the application and then you send it in to Jen and then we have an interview. So it's just a 30-minute conversation. You want to have your project sponsor there and your frontline leader or some combination thereof. Here's what we're looking for. Assurance that your organization is committed. Assurance that SCORE will make a difference. Because if you're already great, this is a pilot. We want to know if it's going to do anything. So if you're already great, we're not going to see any survey results. So that's not helpful. So, that's lovely that you want to do it. And problems are good. Bonus questions that we'll be asking. What's your sense of the number of work group members that want to actually improve respect? Like, we'll kind of be learning about what's going on. What are you, the senior leader and the work group leader? What are you personally looking to get out of it? So we just want to know the motivations. And bonus points awarded for frontline leaders who are optimistic, who are resilient, and who are learners. Just telling you. So that's what we'll be talking about in the interviews. And then we select you and then we begin. There it is. The hope is that the first workshop would be done in April, maybe early May is fine. And then our last one will be done in February 2026 because you take a break in the summer, you take a break at the winter time. So if we're thinking if it's 9 sessions. If it goes beyond that, that's completely fine, but we just need to have reports and things. So Chris, go ahead.
Just a question.
Uh-huh.
Based on your experience, research, etc., what would you say is the #1 reason for a lack of civility in the workplace and poor workplace culture?
I think It's a couple things. I think it's that the work is really hard. It's really hard what your frontline staff's doing. And they may not be equipped. They may not have the emotional intelligence or the social intelligence to navigate it because it's hard. And so when people feel that way, sorry,
Why
go
are
ahead.
some workplaces successful then and other places are not successful? Because we're all drawing from the same workforce.
Yeah. So you may have leaders that can support them. And it's not so easy. If you
No.
have, right, if there's, so one of the key things that we do in SCORE, the first thing is we increase the positivity and we increase the respect. So it's already happening, like it's already there. Even in the worst work groups, it's already there. It's just that people can't tolerate very much disrespect. So it can be it can be one thing and it just throws everything off because people aren't equipped and they don't have, so they're not equipped and they don't have the time to be able to process it and to figure it out together. They don't have the opportunity to get to know people. I just know that you just did something that was really, because we take it personally because we're tired and grumpy.
Mhm.
And then you don't necessarily know how to have the difficult conversation, even if you have the wherewithal. So that's my theory, but Dr. Leiter's probably smarter. He would come
Yeah.
up with better answers, but that's mine.
You know, I think at Trillium, we are so focused and so particular on our leadership hires.
Yeah,
And you just have to be made of certain stuff.
yeah,
And, you know, for us, that's been really successful. And when we've had issues in homes, and we have, inevitably a leadership change happens.
yeah.
And, you know, it does begin and end with leadership. Everything does. Like you said at the beginning, it sets the tone
Totally. Yeah.
100%.
Yeah.
And so, you know, we are just so focused on maintaining that
That's great.
culture in our senior leadership team that, yeah.
True. It's true. And it can
Because
be
this is
hard.
a lot of work, right? If you've got the wrong leader and you've got issues, now
It's
you got to
true.
do this, like, holy smokes, you know,
Yeah.
So,
Yeah. But even then, sometimes things like Tanya and Mari are wonderful lead. Like that, I've been doing this for a long time. They're lovely people and they are good leaders. They are strong leaders and things aren't so easy. So
It's
even
not easy.
with that, right, it can
Mm.
be, things can go off the rails. And so that's one of the things I really like about SCORE is that it comes back to the work group so that it's about them. They're the ones that take ownership of it. So
Yep.
does that answer your question? Was that
It
good?
does, yeah,
Okay,
thank
good,
you.
excellent.
Yeah.
So here's the gist. This is kind of a slide that we always show in SCORE. So actually doing stuff is how good things happen. So if you change nothing, nothing's going to change. So I just want to check with what you said in Mentimeter is you wanted to know how the program works. How did we do? You okay on that? How to implement the program and how to get buy-in from the teams. Have you got that? So I didn't talk so much. It's like you have to promote it. And it's about letting people know that this is their program. That's really how you're going to be able to get buy-in. So you do need to have people that are willing. Even if they're the quiet ones that don't say anything, that just go about their business, that's okay. That's okay. That's fine. And to have them to support them to kind of get the skills is part of what SCORE can make possible. And then how the program works and examples of how it's impacted culture where it's been employed. So that was the video from Tanya and Mari. So is there anything else that's kind of coming up for folks? Okay.
No,
So
excellent presentation. I love your energy.
oh, well, thank you very much. I appreciate that. I appreciate that. And it works. It works with the frontline teams. So me being playful, because I'm not necessarily an extrovert, me being playful and also vulnerable makes it easier for others to do. It kind of sets the tone, right? Because I have a lot of privilege. And so me being like that makes it easier to reduce that privilege and also bring others along. At least that's the theory. All right. If there's so if other folks who are watching this video, because we're going to record it and put it up somewhere, if you have other questions, please send them on into to Jen or to Kajal, or you're welcome to email me directly. My email address is me, as in Mary Ellen, at conduitcoaching.com, and I will CC Kajal and Jen on the response if you have any other specific questions.